Greetings and salutation. I'm Bishop Preston W. Williams II, presiding bishop of the 7th Episcopal District, which comprises the whole state of South Carolina. As you have heard, I'm sure, over the network, be it electronic or print, about the swine flu. This year there are two types of influenza flu. The seasonal flu, and of course we have the winter flu, I guess one could say. There's plenty of vaccine in to help prevent this one, but a new strain of viruses that causes a different flu is spreading throughout the world. No vaccine is available right now, and when it is available, the general population will be notified. There will not be enough of it, perhaps, to go around, and therein lies the problem. Most cases of this new flu are mild, but it can be serious and even deadly for some people, including children, young adults, and those with lung diseases such as asthma, people with poor immune systems, and people with chronic disease such as diabetes and heart disease. Asthma, diabetes, and heart disease occur more often among our people, so we may be at a greater risk of getting sicker from the new flu. The best protection is to prevent ourselves and others from getting it by doing several things. And as we move down, I'll enumerate on those later on. The AME Church can play and will play an important role and part of helping to keep the general population healthy. We are launching in the 7th Episcopal District a district-wide flu prevention campaign. I want to get across with perhaps two messages. The first message is spread the gospel. That's the first thing. And secondly, we must involve in spreading the social gospel, and in turn we will be spreading not just the social gospel, but we'll be helping to stamp out the flu. This means we need to take action to prevent the spread of this new virus. H1N1 is the name of the flu, which that we'll be dealing with this fall, September and October, and perhaps we may have some lingering around even after that. If you cough or sneeze, cough in the elbow. If you have signs of flu such as fever, you're coughing, you have stuffy nose, and sore throat, do not come where there's a large gathering of people. Do yourself a favor and your loved ones, and especially humankind. Wait until your fever has gone for about 24 hours and without having to take medicine for a fever before returning. Well, yes, I want to let folks know that you're not. Okay. Yeah. This is just a demonstration of what one should do, as I have done by shaking the Brother Small's hand. It is should be practiced generally with everyone. Is that after a handshake, one should wash one's hand. Well, it is hard to do. What you've been, and old habits are hard to break. And one of the habits that we're going to have to break is that we must caution ourselves about extending our hands. Because in that, we have to be cognizant of the fact that we may be sharing bacteria. And so you have to be careful about that. And please don't become offended when that happens. It's just that one may be trying to protect not only themselves, but also perhaps trying to protect you. We need to avoid handshaking. That's hard to do if one is a Christian. Hugging is another thing that's hard to do. But I'm not suggesting that you make a permanent case of it, because we are social people. And we do like to shake hand, hug, and kiss at points. The second message is to spread our love to heal from the flu. We must give ourselves in a tangible way so that it will help people, yet not cause any illness to come to them. Perhaps we can do shopping for them and prepare food for them. We all need to pray for those who are sick. And that is the business of the church. The church is always on the front line of prayer. You should spray any surface and let it stay for at least 15 minutes. Perhaps not wipe it off. Let it dry on the surface. The new flu is expected to spread the fastest during September, October. Those are critical months. We all need to do our part to stay healthy, eat wisely, get plenty of rest, drink plenty of water, and do those things that will help you stay healthy. AMEs, as you know, we have long dealt with health issues. And even on our website has been added important medical information that perhaps you and the general population could learn more about how to prevent this new flu from spreading. God bless you. May He keep you is our prayer.